More than 356,000 people have out-of-hospital cardiac arrest in the United States every year. Men are more likely than women to get a bystander CPR in public locations.
Now, last month we hosted a day-long heart telethon here at the station to promote the awareness, needs, and use of being able to conduct CPR. Dr. Brandon Bentley's back with us today with the Department of Family and Community Medicine with Wellstar MCG. Today we're talking cardiac arrest and what can be done to lower those risks. Brandon, thanks for joining us. Appreciate it.
Thanks for having me.
Let's talk about what cardiac arrest actually is and how CPR can help.
Yeah, so very frequently heart attacks and cardiac arrest get used interchangeably, but they are very different. So cardiac arrest is a complete cessation from the heart. So there's a malfunction, it's not beating, so it's not working. Mm-hmm. Heart attack is a vascular issue, so you're having a lack of blood flow. So there's an electrical component, which is the cardiac arrest, and the lack of blood flow, which is more of the heart attack. And CPR is a way to help continue perfusion and to then try to get that heart to restart. So this is a mechanical means, an outside intervention to help try to restart the heart to be able to intervene in the case of cardiac arrest and bring someone back to life.
Now, who is at risk for cardiac arrest?
So, unfortunately, most everyone can have a cardiac arrest event, and unfortunately, sometimes they are just unpredictable, but there are some risk factors that increase your risks of cardiac arrest. Men more frequently have this over women. Age is a factor, so anyone over 45 has an increased risk of cardiac arrest. There's also some genetic predisposition, there are some familial factors, and then there's also some lifestyle factors. So, unhealthy lifestyles, smoking, unhealthy eating, sedentary life, all increase your risk of cardiac arrest.
Are we actually seeing younger and younger people having cardiac arrests over
We're seeing
time?
more reporting of cardiac arrest. We're not necessarily seeing more in terms of numbers, but we as a community at large are becoming more aware of it. It's just being reported in the news more frequently. It's being talked about, and honestly, we want it to be talked about.
Right.
Yes.
We want awareness to this so that we can know that it can happen, so that parents are a little more vigilant and understand that this is a risk, and so that we can have bystanders be willing to intervene when it happens.
And that's why we're talking about this
Yes.
today, too. Training for CPR. People need to know about this. Where can our viewers get CPR training?
So right here in the local area, there are actually plenty of areas to get CPR training. Wellstar has a community training session. The American Red Cross has CPR training. The YMCA has CPR training. These are all very accessible locations for you to get that CPR training so that you can be ready in the case of an emergency.
Very nice. Now, what are the critical components of CPR?
So some of the most critical components, because all of CPR is important, but is ensuring that there are minimal interruptions when doing these compressions, maintaining compressions at an adequate rate and depth. Okay. So making sure that you're not going too fast or too slow. In the moment, the first reaction is to go fast. It's a high adrenaline environment. It's hard to remind yourself that 100 to 120 beats per minute is probably slower than you think. Those pop culture songs that run at about that beat, we use them in hospital settings too. It helps make sure that we're maintaining a rate that's adequate, and then make sure that you're trained. Make sure that you're going out. It's a fairly easy thing to get done, so that when you're doing the CPR, you know what to do. You're not providing too little or too great of ventilation during the CPR itself, and so that you're just prepared in case of an emergency.
Okay.
I'm happy to say that a number of us here at the station, we went through CPR training and AED training as well, to make sure that, if something were to happen here, we could take care of that. But it is so important for bystanders to be able to know how to do this for just anybody, because someone could just drop right in front of you. Yeah. And you're going to be the only person within that group that knows how to perform CPR.
Yeah.
Correct. And whether or not you have an AED, hands-only CPR is incredibly beneficial. There's been reports of somewhat doubling or tripling your rate of return of circulation, of bringing that person back from hands-only CPR. The AED is wonderful. It's certainly a great tool if you have access to it, but that should not limit the initiation of CPR. If you don't have one, it's okay, you want to jump in. And unfortunately, that bystander effect is pretty big. Men are much more frequently getting CPR outside of hospitals than women because people are worried. They don't know where they should put their hands. They don't know how this is supposed to work. So we want to make sure that people feel comfortable and ready just in case it happens. It's rare, but it can happen.
Exactly.
Men are getting CPR outside more often because they're stubborn too, so quit being stubborn, guys.
Yes, yeah. You can save a life. Yeah.
Yes, absolutely. Great points to keep in mind. Again, find those places in our area here to learn CPR. Again, you could save a life. Dr. Brandon Bentley, always great to see you.
Thank you.
Great to see you both.